Today we're going to discuss the ABCs of Part D of Medicare, what's called the prescription drug plans. Be sure to stay to the end of the video for our free offer, so don't touch that dial. Hi, I'm Tim Hanbury, author of Medicare Blueprint. In this video we're going to discuss the prescription drug benefit. This part of Medicare is the most complex of the parts of Medicare because it's so different than what you have with an employer or individual plan. So let's get started. Part D is broken down into 4 levels. You have a deductible level, the initial coverage level, then the coverage gap or the donut hole, and then you have the catastrophic level. The good news is that most people won't get past the initial coverage level. So let's look at each level. Level 1 is the deductible level. These plans can have up to a $405 annual deductible. Except for some generic medications, you'll pay the full cost of your medications until your deductible is met. Next is the initial coverage level. In this level, you'll have either a copayment amount or you may pay a percentage of the cost of the medication depending on the medication and the insurance company offering the plan. You'll have different costs for a generic medication, a preferred brand name, a non-preferred brand name, and specialty medications. You'll continue in this level until your total costs have reached $3,750 in 2018. At this point, you'll transition to the coverage gap or donut hole. Once you meet the donut hole, your costs for medications will be 35% of the cost of a brand name medication and 44% of the cost of a generic medication. You'll continue in this level until your total costs reach $5,000 in 2018. Now, it even gets a little bit better because they will apply the discount that pharmaceutical manufacturers are required to give on the cost of brand name medications. In 2018, they're required to provide a 50% reduction in the cost of a brand name medication. In 2019, this goes up to 70% of the cost of a brand name medication. What this means is that in 2018, you'll pay 35% of the brand name medication, but 85% of the total cost is applied to the donut hole. In 2019, this will go up to 95% of the total cost applied to the donut hole, but your costs go down to 25% of the cost of the brand name medication. In simple terms, this change means that you'll go through the donut hole more quickly with less cost to you. And there are some costs that aren't counted in the donut hole. The most notable is the discounts on generic medications. Okay, so you go through the donut hole once your total costs have exceeded $5,000 in 2018 and $5,100 in 2019. You will then be in the catastrophic level. At this level, the cost for a generic medication will be $3.35 in 2018. The cost for a brand name will be either $8.35 in 2018 or 5% of the cost, whichever is greater. Lastly, you stay in this level for the rest of the year. Now, I've had clients who tell me that they're not on any medications, so they simply don't need a Part D prescription plan. And I understand why they feel that way, but you need to be aware that there are financial penalties if you don't sign up for a Part D plan when you're first eligible. They will apply a penalty based on each month you didn't have coverage, and it's a permanent penalty that will increase each year. While this penalty isn't as large as the penalty under Part B of Medicare, it can add to your costs as it's in addition to the plan premium that you'll pay. Keep in mind that in most states, there are inexpensive plan options that are between $15 and $20. As with Part B of Medicare, if you're considered a higher income individual, there will be an income-related monthly adjustment amount on your income from 2 years ago. Again, like with Part B, if you've had a situation where you'll be making less money once you're on Medicare, like retiring and not earning a wage, you can apply for a life event change and ask for a new initial determination. Okay, so you're probably thinking, Tim, how do I pick from the 20+ plans that are available? Well, believe it or not, Medicare.gov has an excellent tool to help with this. When you go to Medicare.gov, on the home page, you'll find a green box called Find Drug and Health Plans. When you click on the box, it'll take you to the Plan Finder tool. On the right-hand side of the screen is a Plan Finder multimedia section, where you can watch a series of videos that will show you how the tool works. It can be a bit confusing, so if you want to review this yourself, please watch the videos. There are also other ways that you can do this, especially if you're not a computer person. You can work with an agent who can do this with you. You can call the insurance company that's offering the plan, or you can call Medicare directly and they'll do the work with you. Now, here are a couple of things that you need to know when you're looking at coverage. First, you have to review the listing of covered medications, or what we call the formulary, to make sure that your medications are covered under the plan. You need to do this prior to signing up for a plan, and then each year after, because the formulary can and will change each year. With the cost of prescriptions today, we recommend that you review the listing of covered medications first. Also, you need to look at what pharmacy you want to use. This can have an impact, as the pharmacy you want to see may not participate with the plan you're considering. And some pharmacies will have a lower cost for your prescriptions. And lastly, we always recommend that you get a Part D prescription plan when you're first eligible for coverage. The reason is that you never know when you may need to get a prescription. One antibiotic can cost hundreds of dollars. In addition, in most states, you can get coverage for as little as $15 to $20 per month, and by signing up for coverage, you won't incur a penalty. Now, I know that's a bunch of information, but it can have a real impact on your health and financial well-being. So it makes sense to get a Part D prescription plan. If you have any questions, please comment and we'll reply or cover your question in an upcoming video. If you'd like to stay informed on everything Medicare, please subscribe to our channel. Thanks for watching the video, and as promised, click on the link in the description to get your free offer.